It's Michael Overcash. I'm doing this as an educational piece to help people practicing dermatology that are maybe new in their career. One thing very important for us when we start a patient on light therapy is to know exactly what dose to give them and how fast to increase. Now, when I say light therapy, what I mean is ultraviolet therapy. So many dermatologists, including everyone in our practice, use narrowband ultraviolet type B at about 312 nanometers and ultraviolet A to treat numerous skin conditions. This is the most effective thing we have to treat vitiligo at all, by far. It works better than anything there is. It's also very effective for psoriasis, for atopic dermatitis, for pruritus of unknown origin, neurodermatitis. It works very well for cutaneous T-cell lymphoma. Yes, we're treating skin cancer with a tanning bed. But it's phototherapy, very targeted, very specific wavelengths of light. It's very important when we start somebody, we need to know how their skin is going to respond. We have to calculate using no physical tools, but a history and physical exam. What is their minimum erythema dose? Minimal erythema dose is how much light it takes to burn somebody. Some burn very quickly, very easily. Others can withstand several minutes, which would normally burn a fair-skinned person easily. So the darker skin types do better with higher fluences, greater flux of light, and we can increase them faster. Now, the caveat to that is if they have vitiligo, it doesn't matter what type of skin they have. They have white, bone white, depigmented skin. That is the fairest skin tone you can have. And those people we always treat as if they're type 1. What's a type 1? So the Fitzpatrick skin types are 1 through 6. Type 1 is someone who always burns, never tan. Type 2 sometimes tans a little. They can tan some, but they usually burn. Type 3 sometimes tan, sometimes burn. Type 4, they tan very darkly and rarely burn. Type 5 rarely burn, always very darkly tan. And type 6 never burns and stays dark, and maybe even doesn't tan, they're so dark. So those are the Fitzpatrick skin types. So it's an algorithm using history and physical, not any kind of a metering device. Race has been a part of the tool, but as Johnson & Johnson found out in 2024 through the Visible trial, with hundreds of patients, all of them skin of color, they found a very poor correlation between race and Fitzpatrick skin type. For example, people that reported themselves Hispanic had everywhere from 1 all the way to 6. People that check the box for African American, 4, 5, 6. Same with other ethnicities. There's a very poor correlation. So what I recommend is we really need to revise this tool not to include race at all. And we have data to back that up, thanks to Johnson & Johnson. So the real way to do it is a step-by-step assessment. You get the history, like I explained about burning, always burn, never burn, sometimes burn, and then examine parts of their body like their underarm, their buttocks, places that don't get sunlight. And as an expert who looks at skin all day long, you're going to know if this is the fairest or a middle or the darkest or nearly fairest, nearly darkest skin type. Is there any tan at all, any brown color, or is it purely whites and pinks? Look at hair color and eye color. If they have blue or green eyes, they have light hair, freckles, that can pull you down towards the lower numbers. However, it's possible to have a type 4 patient that has freckles or blue eyes, so you can't use those completely. The better index is the history of burning and looking at their skin that's not been in the sun. So the pitfall is relying on self-reported race is not a good option. My sources for this are actually Fitzpatrick himself, and Sachdeva in 2009 called Fitzpatrick Skin Typing Applications in Dermatology, and Bologna, which is a textbook that most of us use in 2021. It's just called Dermatology 4th edition. So I hope you enjoyed it. I hope that makes sense, and hope you enjoy just getting patients started and seeing them get better and at their pace. Thank you.